I guess I was on a question. Oh, goodness. All right, I was in the middle of the slides reading them. There we go. So we have a lot of different things that we're covering today, interestingly. But the number of slides is realistic, so we should be good. So first, we're going to do comfort, chronic pain, and rest and sleep. So which concept should the nurse consider when assessing a patient's pain? A, the expression of pain is not always congruent with the pain experienced. B, pain medication can significantly increase a patient's pain tolerance. C, the majority of cultures value the concept of suffering in silence. Or D, most people experience approximately the same pain tolerance. You're off to a good start. I can tell you that. So for this, in looking at the questions, the answers, sorry, you need to know what pain tolerance is, don't you? So if you have that definition mixed up, you could have an issue, right? So this is where application comes in as opposed to knowledge, because the knowledge is embedded in the question and the answers. I'm going to end the poll. So the correct answer was A, okay? So an obvious response to pain is not always apparent because of the psychosocial cultural factors that dictate behavior. Fear of treatment and pain, the lack of validation and acceptance of pain as punishment for previous behaviors, and the need to be strong and courageous and uncomplaining are factors that influence behavioral responses to pain. So who can give me the definition of pain tolerance? Can someone tell me that? Can you look it up in your notes? Did you get it in your notes?
Pain tolerance is the maximum amount of pain that someone could like stand out or like withstand before they try to get help to relieve it.
Okay. So that's different with everyone, isn't it?
Yeah.
Right. So D, which actually no one put, is totally wrong, isn't it? So most people experience approximately the same pain tolerance is out of the question. That's why no one put it. But pain medication doesn't really, do you understand, with hearing the definition, do you understand why pain medication doesn't increase a patient's pain tolerance? It's actually, the pain med's actually helping the pain, right? Now, the one word that I see in B What's one of the words that I really don't like in B anyway? Anyone know? What's a word that jumps out at me that says, oh, wow,
Is it the significantly increase?
you've got it significantly. As soon as I see significantly, I'm like, oh, they're saying it's doing it a lot. That's even more interesting. Then when C, what's the word that's jumping out at me? Do some cultures value the concept of suffering in silence?
Yes.
Do the majority? No. So you see how majority hit me in the face? Like the majority? No, some cultures do. They don't want to admit their pain, do they? So you could say that they value the concept of suffering in silence. But to say it's the majority of cultures makes that one wrong. Now, I'm not saying it'll always be wrong, but when I see majority, it makes me really think twice about putting that answer. Same with significantly increasing or significantly decreasing. By the second post-op day, a client has not achieved satisfactory pain relief. Based on this evaluation, which action should the nurse take according to the nursing process? A, reassess the client to determine the reasons for inadequate pain relief. B, wait to see whether the pain lessens during the next 24 hours. Change the patient plan of care to provide different pain relief, which is C. Or D, teach the client about the plan for managing his pain. Come on, some more people go ahead and use the put an answer in. We have 11 people, 12 people on here. Okay, I'm getting ready to end the poll. And the correct answer was A. Everyone got it that answered.
Can I just ask, like,
Sure.
why C wouldn't be a correct answer? I know you have to like assess, but like in some cases, I feel like some people would choose C too.
Okay. Um, all right, I agree with that. But before you change the plan of care to provide different pain relief interventions, you want to reassess the client to determine maybe the reasons for inadequate pain relief. So that would almost be step one, and then kind of gathering your information about why it's not working and um are um they waiting too long? What's going on? When is their pain? Is it when they're moving, or is it just at rest? um Maybe discuss some of those other interventions. Does that make sense or no?
Yeah, that makes sense.
Okay. So I think it's almost, I think A is a step towards C. And then under here, various factors might be interfering with the level of comfort. So here it talked about collecting further data to determine why that pain management isn't working. Okay, good question. I actually had an incident where I had surgery, and under anesthesia, I heard the physician's assistant say I could not take any non-steroidals because I was allergic to them. And while under anesthesia, I heard that and I wanted to yell, "That's not true. I'm only allergic to one of them. Gives me asthma issues." So then my pain wasn't being managed. It was like I had pain that could not be managed. And the nurse came in and said she was going to call the doctor, but it's hard because we usually give this certain pain med IV for this, but you can't have it because you're allergic to all the non-steroidals. And as soon as she said that, I remembered hearing it under anesthesia when I was starting to come out of anesthesia. And I said, "Oh my gosh, that's wrong. Please call my doctor and tell him that Relafin is the only non-steroidal that I can't take. I can take the other one." So then she called and told them that they ordered that pain medicine. And within the hour, my pain was manageable for the rest of the time. I don't know if that story will help you or not. Looks like people have already read this and answered. A nurse who's admitting a client who has a fractured femur obtains a blood pressure reading of 140/94. Client denies a history of hypertension. Which action should the nurse take first? So that's the big thing. I would denies history of hypertension and take first. So all of these answers would, in my mind, are going to be feasibly correct answers to some degree, but none of them is what you would ever do first. So the first one is request prescription for an antihypertensive. B is ask the client if they're experiencing any pain. C, request a prescription for anti-anxiety med. And then D, return in 30 minutes to recheck the client's blood pressure. So the key things here are fractured femur, the blood pressure reading, no history of hypertension, and action to take first. Okay? So the answer is B, because we know that the client has a fracture. So we want to assess their pain. Are you experiencing any pain, or you can tell me about your pain? Now, if they were not having any pain, let's say that they're having pain and I give pain medicine. I'm going to come back and recheck their blood pressure in 30 minutes to see if it's elevated still. Okay, if they deny pain, like any pain at all, and they'd already had pain medicine, then, but the question didn't say that. then I would just come back in 30 minutes and check their blood pressure again, and maybe talk about pain medicine if it's due again. Does that make sense? Patient had a total abdominal hysterectomy 2 days ago and reports abdominal pain at an 8 on a 0 to 10 pain scale. After assessing the pain further, what should the nurse do? A, reposition the patient. B, offer a relaxing back rub. C, use distraction techniques. Or D, administer pain med. Okay, and with it, and the poll. Is an interesting smattering of answers. So the correct answer for this is to give the pain medicine. Are you going to do the other things too, though? Like, why is that such a big deal? Well, I would reposition the patient and get them, if possible, into a comfortable position, but their pain is an 8 out of 10. So I would administer prescribed analgesics. For a pain of an 8 out of 10, if pain med is due, that's pretty much what's going to help them. So I don't know that a back rub at that point would help unless their pain is in their back from laying on the back. Distraction techniques are also important to use. You kind of want to use everything, but they really do need pain medicine. All right, let me relaunch this.
Why can't you reposition the patient first and see if that's a little better before you give them pain meds? Like that, this question.
Think about it if you were the patient and you've had major surgery where they manipulate, do a lot of work in there, and your pain level is an 8 out of 10. And your pain medicine is due, which I know this doesn't say that. But an 8 out of 10 is a lot of pain. And like that is more of a severe pain. And that's why, as long as that medication is due, we're going to give it. Now, we may ask, is there a more comfortable position you can lay in? But the pain may be too bad to try and even get into that position yet. Does that make sense? If you think about it being you and you've had major surgery and you put your call bell on and say that my pain's really bad, it's an 8 out of 10, you would assess it, they would assess it further. What kind of a pain is it? Where is the pain? All of that. But then administer the prescribed pain analgesic. Does that make sense or no? Patient requests pain medication for severe pain. Which should the nurse do first when responding to the request? This is like the other one, I guess. A, distraction to minimize the patient's perception of pain. B, place the patient in the most comfortable position. C, administer the prescribed pain medication to the patient. Or D, assess the various aspects of the pain. So here the patient is saying they have severe pain and they're requesting their pain medicine. What do we do? Which I feel like this is a little tricky on the heels of the other one, but it's asking something different. I'm getting ready to end the poll. So with this one, instead of just give the pain medicine, we don't know, and we need to know more about the pain. We need to know what does severe mean to that person. So what is it on a 0 to 10 scale? And then what are those other factors about the pain? So you haven't really done your assessment yet. You need to know the intensity, the quality, the duration, the pattern, aggravating and alleviating factors, and then some maybe physical, behavioral, and attitudinal responses. Does that make sense to everyone? People that put C? Patient has a history of severe chronic pain. Which is the most important intervention associated with providing nursing care to this patient? A, asking what is an acceptable pain level. B, providing interventions that do not precipitate pain. C, focusing on pain management interventions before pain is excessive. Or D, determining the level of function that can be performed without pain. So which is the most important intervention related to chronic pain? So here I would underline history of severe chronic pain and most important intervention. I'm going to end the poll. So the answer here is C, focusing on pain management interventions before the pain is excessive. So with they're talking about administering the analgesic maybe around the clock at regularly scheduled intervals or by a long acting control release like a transdermal patch, trying to maybe maintain some therapeutic blood levels, which limit the pain at levels of comfort that's acceptable to the patient. So you need to know what's acceptable, but you need to not let it get excessive. Sometimes what you'll see are patients on Tylenol around the clock to kind of keep a pain level at bay, then add to it as needed to try and help it not get out of control and have that severe chronic pain. Nurses assessing a patient in pain, which word might the nurse use when documenting the pattern of the patient's pain? A, tenderness, B, moderate, C, episodic, or D, phantom. So here the key word is the pattern of pain, patient's pain. Anyone else want to answer? Get ready to end the poll. So you need to know what episodic means to answer this, and it refers to an incident, occurrence, or it's related to the time period. And that's what the pattern of pain is. Is it like, is it after moving, or like, what is it? I don't want this to get confused with the episodic referring to the incident or occurrence of, or the time period of pain, to be confused though with incident breakthrough pain. That is different, okay? Nurses caring for patients receiving a variety of interventions for pain management. Which pain relief management has the shortest duration of action? Pain controlled analgesia, intramuscular sedatives, intravenous narcotics, or regional anesthesia? So we're looking for the shortest duration of action. I'm going to end the poll. So the answer here is C, that your intravenous analgesics they're great in that you give them and they act within 1 to 2 minutes. I mean, by 4 minutes, you're feeling a fair amount better, but they do have the shortest duration of action. Intramuscular would be next with a longer duration, and then PO meds next. A nurse is talking with a client about ways to help him sleep and rest. Which of the following recommendations should the nurse give the client to promote sleep and rest? select all that apply. So A is muscle relaxation techniques to practice them. B, exercise in the morning. C, take a nap in the afternoon. D, alter the sleep environment for comfort. Or E, limit intake at least 2 hours before bedtime. I'm going to end the poll. So this ended up being everything but C. So if, exercise routinely, regularly, if it said to do this an hour before bedtime, then it would have been wrong. It's at least 2 hours prior to bedtime. Limiting fluids, before bedtime can really help minimize getting up to urinate, but also minimizing, you don't want a real big meal 2 hours before because you want to kind of start getting it digested. Make sense? Oh no. Just get this smaller. There we go. Nurse is caring for a patient who is diagnosed with narcolepsy. Which is the most serious consequence of this disorder? A, inability to provide self-care. B, impaired thought process. C, potential for injury. Or D, excessive fatigue. Getting ready to end the poll pretty soon. So here I would underline narcolepsy and most serious consequence. And C is the answer for this. We really worry about potential for injury. Being tired is very annoying, like the fatigue, but it's not necessarily like the most serious. The most serious would be that would turn into a potential for injury. Nurses planning a teaching program for a patient with diagnosis of obstructive sleep apnea. Which should the nurse plan to discuss with this patient? A, using the ordered device that supports airway pressure. B, placing 2 pillows under the head when sleeping. C, requesting a sedative to promote sleep. Or D, sleeping in a supine position. I'm getting ready to end the poll. Oops. I nailed this one. A, using the device. Most of those other things are actually contraindicated. Which is the most important nursing intervention that supports a patient's ability to sleep in the hospital setting? A, provide an extra blanket. B, limiting unnecessary noise in the unit. C, shutting off all lights in the patient's room. Or D, pulling the curtain around the patient's bedside. I'm going to end the poll. So the answer is B. That's the most thing that people complain about, is that it was too noisy to be able to sleep. For those of you, at least I know at Christiana, I'm thinking they may have them at Wilmington, but have you noticed the red light, green light things in the districts at the hospital at Clinical? Has anyone noticed them? Okay, they're related to noise, which is the most common cause of sleep deprivation in the hospital that the nurse should consider when planning care. A, fragmented sleep. B, early awakening. C, restless legs. Or D, sleep apnea. I'm getting ready to end the poll. So it's A, fragmented sleep. That's the biggest, another big complaint is that I no sooner got to sleep and they woke me up. So sleep deprivation occurs with frequent interruptions of sleep because the sleeper needs to return to stage one rather than the stage that where they were when they were interrupted. And there is a greater loss of stage 3 and 4, the non-rapid eye movement, which is essential for restorative sleep. Did you guys learn the stages of sleep or no? I wasn't seeing them in the lecture notes.
We learned stages of sleep like way back in like the first module, I think, or the second module, but there was like maybe like one slide on sleep for this whole module. So I don't I don't think there was a whole lot on sleep and the
Okay,
pain.
so I forgot that they had switched it, is what happened. They probably did it with health promotion. I kind of liked it more with this. I mean, I get having it there, but I think you really need to refresh that to get this. Yeah, I saw changes and I was just like, oh my, what went on there? Thank you for answering. Patient has been in the intensive care unit for 3 days. For which common adaptation include indicating ICU psychosis associated? Wait a minute, for which common adaptation indicating ICU psychosis associated with sleep deprivation should the nurse assess the patient? Hypoxia, delirium, lethargy, or dementia? Did you learn about ICU psychosis?
No, we did.
Okay. It what happens is that the patient gets very confused and he can almost get combative at times. And what it's related to is lack of sleep and then being overstimulated with all of the machines and the different call bells going off, the cardiac machine, you know, if a lead comes off or your heart rate goes up or down any, it wakes you up. All the IVs that beep when they're running out, that kind of thing. So it's like an overstimulation thing. Lights are on. There is no day and night in intensive care. If your vital signs are every hour, they're every hour all through the night usually. So the answer for this is B, delirium, unless I'm wrong. Yeah. Um, and the reason is let me end the poll, share your results. Hypoxia is the lack of oxygen, and I understand why people put that, especially not knowing that this is like an overstimulation thing. So this is specifically related to ICU psychosis. Dementia is, you need to know the difference here. Dementia is like an irreversible level of confusion, where delirium is a reversible level of confusion. People, which concept associated with sleep should the nurse consider to plan care for a hospitalized patient? A, patients require 8 hours of uninterrupted sleep to meet energy needs. B, frequent nighttime awakenings decrease with age. C, fear can contribute to the need to stay awake. And D, bed rest decreases the need for sleep. Getting ready to end the poll. So the answer is C, fear, loss of control of the unknown, potential death results in a struggle to stay awake, which interferes with the ability to stay relaxed. Let me see here. I think the argument of A would be the full 8 hours of uninterrupted sleep to meet the energy needs. We do want to give them as much interrupted sleep as possible. So that's where you kind of space your vitals. Like you may go in and do vitals and your assessment at midnight, and then you don't really want to be going in and, if you have meds, you don't want meds due at 2 a.m. You really want them due at 11 or 12. And you don't want to have to wake them up in the middle of the night as much. So here, with sensory perception and hearing loss and diseases of the eyes, a nurse is caring for a patient who is blind in the left eye and visually impaired in the right. Which action should the nurse employ to promote communication with the patient? So here you have to remember blind in the left eye and visually impaired in the right. So they really have visual issues, and they're actually blind in one eye. A, touch the patient's left arm before initiating a conversation. B, ensure that the door to the patient's room is on the patient's left side. C, close the window, curtains, and dim the lights before speaking. Or D, knock on the door and request permission to enter the room. Could end the poll. So the answer is D. Knocking on the door before you're entering the room alerts the patient that someone is at the door and requesting permission to enter the room. Also demonstrates respect and privacy, provides privacy. This gets funny though when you have a room with two people in it. So not lots of times what we do is we knock, we go in, but then when like if a curtain's pulled, we always go and kind of, you know, say that we're outside of that curtain too. Touching the patient on a visually impaired with a visual impairment before speaking can be an intrusive action and can startle the patient. Okay, a newly hospitalized 90-year-old client has difficulty answering the nurse's questions and reports progressive hearing loss. Which nursing action would be the best aid in communication between the nurse and the client? Over exaggerating facial expressions, using simple sentences, over enunciating longer words, or speaking quickly at a higher pitch voice. So we have progressive hearing loss, and this is a hearing loss of a 90-year-old. So what are you gonna do to help that client communicate the best? Getting ready to end the poll. And the answer is to use the simple sentences to assist in communicating the client. So there are fewer words to try and decipher. Let me see, what was C again? I think I was looking at the wrong one. Yeah, you don't want to over enunciate anything. That makes it harder for patients to understand what you're saying. A lot of the rules are related to not over enunciating. You don't necessarily want to speak slowly, but you do kind of want to keep it almost in a normal. You don't want to talk quickly. If you're someone who talks quickly, you want to slow it down. High pitched is always harder to understand than lower pitch. The nurse is reviewing the chart of an older adult client. Which sensory changes does the nurse anticipate have occurred? So which of these would you see in the elderly? Increased tactile sensation, decreased sense of taste, decreased sense of hearing, impaired sense of smell, increased sense of taste. I'm gonna end the poll soon. So we have decreased sense of taste, decreased sense of hearing, and impaired smell. Exactly right. Nurse is caring for an older adult client that requires a visual aid for reading. Based on the client's need, which visual change has the client experienced? Hyperopia, nearsighted, presbyopia, or myopia? So I think this is one of the ones that could be hard if you don't have your definitions down pat, because you start looking at this and then they all spin around in your head and then you get confused. So this is one of the ones I'd probably be more interested in thinking of the name before I even open the answers. And the answer is C, it's being farsighted, caused by loss of elasticity of the lens of the eye, occurring typically in middle or older age. So you have to remember, farsighted is what you can see. You can't, with presbyopia, you're having trouble reading things, okay, that are close up. Which of the following should the nurse recognize as risk factors associated with glaucoma? Select all that apply. Gender, genetic predisposition, hypertension, age, or diabetes. So this, as difficult as this is a basic knowledge question. So knowledge questions are strictly memorization. And that is what this is. Only it's a select all that apply, which makes it harder. And I'm not minimizing how hard it is. I'm just saying that this is straight up memorization, and it's probably just the fact you've memorized one slide. Going to end the poll. So the answers are B, C, D, and E. So gender is the one that is not correct. Okay. A for gender.
I want to go back to that because in the PowerPoint it says that what's it? Diabetes is under it's like is a factor associated with cataracts. Not so is it both?
Yeah,
Okay.
it is both.
I think they told us that diabetes that affects everything, so just assume diabetes is a part of all of it.
There's a chart in the book. Oh God, I don't know if it's a chart in the book anymore. Do you have any charts in the book for this? There was a chart in the old book that I would refer students to. But yeah, diabetes really does affect everything. When caring for a client suspected to have Meniere's disease, which of the following is an expected finding? A, the presence of purulent lesion in an external ear canal. B, recent history of plane travel. C, bulging red bilateral tympanic membranes. Or D, unilateral hearing loss. I'm going to end the poll. And the answer is D, unilateral hearing loss. Did you learn this?
No, this wasn't definitely not like in our
All right,
class sheet
I'm going to
PowerPoints.
remove it. I'm going to remove this slide. When I read it now, when I read it before, I thought it was all right. When I read it now, I'm like, I doubt even learned this. I'm trying to remember if I taught it when I was teaching the class. And I may have,
Regarding vertical too, the disease.
what's that?
That disease talks about vertigo, right? This has symptoms of vertigo.
Yeah, it does.
I remember something about vertigo. Well,
What's that?
I rem I just remember something that the professor said about vertigo
Did
and I
you?
thought this was part of it, but I might be wrong.
Okay, I'll look in the lecture stuff for, again, disease of the inner ear that can cause a person to get dizzy. Feeling of vertigo, spinning, lose some of their hearing and have ringing in an ear. The ears can feel full. I'll look. Sometimes, honestly, I'm reading these things and the things come to me more when I'm teaching it. I'm trying to put myself in the position when I'm reading my slides, but which assessment finding would indicate hearing loss? Patient converses easily with the nurse. The patient answers questions appropriately. The patient's face is relaxed during the conversation, or the patient speaks very loudly. Thank you for your comments. When you're making comments, I don't always take the time to comment back. I appreciate them though. I'm going to end the poll. So the patient speaking loudly is definitely the answer. Like they're not able to hear as well, so consequently they're talking louder. Patient must place his hand on the wall to keep his balance when walking. He leans when sitting and has difficulty knowing when his body is vertical and sensing the position of his body in space. Which type of receptors is probably involved? The type of receptor. Getting ready to end the poll. So it's C, the proprioceptors. Proprioceptors. Oops, stop sharing. Peripheral neuropathy and paresthesia becomes the etiology for other nursing diagnosis, which is an example of appropriate nursing diagnosis. Risk for injury, impaired swallowing, fluid volume overload, or social isolation. Getting right in the poll. So it's risk for injury. Any questions? Do you understand why a risk for injury is an appropriate nursing diagnosis? Okay, the nurse is caring for a confused patient with dementia. Which should the nurse do to prevent this patient from falling? Encourage the patient to use the corridor handrails. Place the patient in a room near the nurse's station. Reinforce how to use the call bell, or maintain close supervision. I'm gonna end the poll. And the answer is D, to maintain some very close supervision. These patients with dementia, when I was an instructor, my group went to 6A, which was the acute care for the elderly, and it wouldn't be uncommon at all to see, come in the morning and see at least one patient, like two patients sitting in each pod, each district. So one per pod sitting in the hallway sleeping, whether in a jerry chair or in the bed, but that's how they tried to maintain their close supervision. To say to use the call bell with dementia, they're not going to remember that. Primary care provider orders a vest restraint for a patient. Which should the nurse do first when applying the restraint? A, perform inspection of the patient's skin where the restraint is applied. B, ensure the back of the vest is positioned on the patient's back. C, permit 4 fingers to slide between the vest and the patient. Or D, secure the restraint to the bed frame using a slip knot. So the big thing here is first. Did everyone pick that up? Gonna end the poll. And everyone got that right. You want to check their skin first before you would ever put the restraint on. Check for any kind of pressure or friction areas. So you need that baseline assessment. Risk management coordinator is preparing a program on the factors that contribute to falls in a hospital setting. Which factor that most often contributes to falls should be included in this program? Wet floors, frequent seizures, advanced age of patients, or misuse of equipment by nurses. So here the key is which factor that most often contributes to falls. So which of these most often contributes to falls of patients? Wet floors, frequent seizures, advanced age, or misuse of equipment by the nurses. Going to end the poll. And the answer is C. Just the advanced age really is a major contributor to fall, where patients can be frail and lack stamina, and all of these factors will contribute to the inability to maintain balance and ambulate safely. Balance is the biggest thing that people are losing as they age. The nurse is assessing a patient who is admitted to the hospital, which is the most important information that indicates whether the patient is at risk for physical injury. Weakness experienced during prior admission, medication that increases intestinal motility, two recent falls that occurred at home, or the need for corrective eyeglasses. So which is the most important information? So all of these contribute to risk of physical injury and falls. I'm going to end the poll. So the answer is C, those the falls that happened prior. Even though it was at home, they're a big risk factor. What should the nurse do to best prevent patients from falling? Provide a cane, keep a walker, walkways clear of obstacles, assist the patient with ambulation, encourage the patient to use hallway handrails. So here, when we think about best preventing patients from falling, we're thinking all patients. Not just one category of patients. So then here you want to think about what are the reasons why people can fall. I'm going to end the poll. And the answer C, using a wide base of support to improve balance and risk for falls, which let me go back here to read it for you. So assisting the patient with ambulation. So it is really important to keep walkways clear of obstacles, but we need to remember that, you know, for the most part, patients in the hospital are feeling weaker. They may have had pain medicine and different things that it's important for them to keep a wide base of support. And, you know, how many patients do we tell them that, you know, I know you can walk to the bathroom on your own, but I would rather be there with you. You know, you've had pain medicine, if you will. Okay. Two nurses prepare to lift a client up in bed. Which of these should the nurse do to help avoid injuring their backs? A, bend from the waist. B, lift. Sorry. There. B, lift with the back and not with the legs. C, lower the head of the bed about 30 degrees if the client can tolerate it. Or D, make certain the bed is in a reasonably high position. I'm going to end the poll. And it's a D, to make sure that the bed is high enough for you to be able to help them up in bed. Which is the last step in making an occupied bed that the nurse should teach the nursing assistant? Elevating the head of the bed to a semi-Fowler's, ensuring the patient is in a comfortable position, lowering the height of the bed to the lowest position, raising all sides of the bed, rails of the bed. So the very last step.
Oh, see, shit.
Going to end the poll. The answer C, to make sure you lower that bed to the lowest position. So when you look at the other answers, ensuring the patient is comfortable in a comfortable position, that would be done before lowering the bed. You don't raise all of the side rails because that's a restraint. So if there are 4 side rails, you raise 3. And if there's 2 side rails, you only raise 1. Oh my goodness. Okay. A client who has had a total hip replacement is disoriented to time, place, and person. The client is attempting to get out of bed and pull the IV line that is infusing antibiotics. Pull out the IV. The client has bilateral soft wrist restraints and a vest restraint on. Which of these interventions by the nurse are appropriate? Select all that apply. A, ask the client if he needs to use the bathroom and provide range of motion exercises every 2 hours. B, document the type of restraint used and assess the need for continued use. C, tie the restraints to the side rails of the bed. D, obtain a new healthcare provider order for the restraint every 12 hours. E, observe for correct placement of the restraints. And as E, then F, tie the restraint in a quick release. Okay. Gonna end it. So it's A, B, E, and F. So let me look here. Yeah, D was to get the order for every 12 hours. It's every 24 hours. Excuse me. Okay. Nurse discovers a client on the floor when entering to conduct a shift assessment. After examining and assisting the client to safely back to bed, the nurse is about to leave the room. Which action should the nurse implement first? File an incident report, put the bed alarm back, place the client in one-on-one observation, or notify the nurse manager. So the nurse is getting ready to leave the room. What do they do first before they leave? I'm going to end the poll. And the answer is B. Before you do anything else, you really need to get that bed alarm back on. So you found someone on the floor. Yes, you're going to file an incident report, but that's never really the priority. You may need to place that client in a one-on-one observation, but before you leave the room, you need to get that bed alarm back on. So if they are starting to get up, you actually can run right back in. Okay? And you would be notifying the nurse manager too. A nurse educator is teaching a group of newly hired nursing assistants which hospitalized patient should they be taught is at the greatest risk for injury. School-aged children, comatose teenagers, postmenopausal women, or a confused middle-aged man. I'm getting ready to end the poll. And it is the confused patient. No matter what age, if someone's confused, they're your priority. A nurse in the education department of a community hospital is planning an in-service education class about injury prevention, which factor that most commonly causes physical injuries in the hospitalized patient should be included in the teaching plan. Malfunctioning equipment, failure to use restraints, visitors, or falls. And the poll. And the answer is D, like you all put. Which is the priority nursing intervention to prevent patient problems associated with latex allergies? Use non-latex gloves, identify people at risk, keep a latex safe supply card available, or administer antihistamines prophylactically. I'm going to end the poll. So B is the answer. Patient allergies, like you need to identify the people at risk, so you are going to ask. But personally, I think A and B are a hard call. They're not really going to keep a latex safe cart for the most part, but you do need to know who is at risk. I feel like many times we're just using non-latex gloves, though. But you do want to always know who is at risk and ask about latex allergies, though. Does that make sense? Okay, which nursing intervention enhances an older client's sensory perception, thereby helps prevent injury when walking from the bed to the bathroom? Provide adequate lighting, raising the pitch of the voice, holding onto the arm of the patient's arm, or removing environmental hazards. I'm going to end the poll. You guys are good because all of those sound good, but what the question said was to enhance the client's sensory perception and therefore help prevent. So their senses for vision are enhanced when you provide adequate lighting. Very good. Which is the first action the home care nurse should employ to prevent falls by an older adult living at home? A, conduct a comprehensive risk assessment. B, encourage the patient to remove throw rugs in the home. C, suggest installation of adequate lighting throughout the home. Or D, discuss with the patient the expected changes of aging that place them at risk. I'm going to end the poll. And the correct answer is A, doing that risk assessment. So you really want to look around and identify things that could cause risk for falls. And yes, one of those are throw rugs, but also, if they're using any aids like a walker, make sure that it can get through everything and clutter and things like that also. Oops, I think I'd already shared this. Okay, here's a math problem. Nurse is preparing to administer digoxin, 0.25 milligrams daily. Available is digoxin 0.125 milligram tablets. how many tablets will the nurse administer per dose? Patient was discharged on the same digoxin dose. A home health, oh, this is, so there's two answers to this, okay? The patient was discharged on the same digoxin dose. A home health nurse comes weekly to assess the patient and fill a weekly medication planner for the patient. How many tablets would a home health nurse use to fill a 1 week medication planner? So the first answer is going to be how many tablets will the nurse administer? And the second one would be how many tablets would you need to fill a 1 week medication planner? Okay. So here's the one way of doing this, or two ways. The tablet overdose or desired over have. So we come up with, you would give 2 tabs of the 0.125 milligrams. And then over 7 days, you would need 14 tabs to fill in the medication planner. Okay. So I'm going to download this to, no, I don't want to be signed out. Oh boy. Okay. Any questions? Let me send this to everyone. Okay, everyone. Thank you for coming. No questions from anyone?
Everything. Bye.
Bye-bye. Thank you.
Have a good one.
You too. Bye-bye. Okay, guys, I'm gonna sign off. You good?